How to beat burnout in healthcare. Recognize early signs and set boundaries to protect your energy. Hello and welcome. If you're a healthcare professional or a caregiver, I want you to pause just for a moment and listen. Because today, we're not talking about patient care. We're talking about you, about your well-being, your energy, and your future in this essential, demanding, and deeply human profession. Recognizing burnout. Burnout is not a buzzword, it's a silent epidemic sweeping through our hospitals, clinics, ambulances, and homes. The data is clear. Up to 68% of healthcare workers report at least one dimension of burnout, and the numbers are even higher in nursing and caregiving roles. Burnout isn't just about feeling tired, it's about losing the light that brought you to this work in the first place. But there is hope. Today we will show you how to recognize the early signs of burnout and, most importantly, how to set boundaries that will protect your energy so you can continue to care, to heal, and to thrive. Next, behavioral changes and importance of early recognition. Recognize early signs of burnout, the science of self-awareness. Burnout is not a personal failing, it's a predictable response to chronic, unmanaged stress in high-demand environments. Peer-reviewed research and validated tools like the Maslach Burnout Inventory and the Copenhagen Burnout Inventory have identified the core dimensions of burnout: emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. What does burnout look like before it breaks you? Emotional exhaustion. You feel persistently drained even after rest. There's a sense of dread before each shift or caregiving task. You might notice anger, frustration, anxiety, or a creeping numbness. Cognitive changes, difficulty concentrating, making decisions, or a rise in cynicism and self-doubt. You ruminate over small mistakes, question your competence, and fear letting others down. Physical symptoms: insomnia, chronic fatigue, headaches, gastrointestinal issues, and a weakened immune system. These are not all in your head. The body keeps the score. Social withdrawal. You feel isolated, alienated from colleagues, friends, or family. You may start to withdraw, lose your sense of humor, or feel detached from your work and your patients. Behavioral changes. Increased irritability, lack of empathy, or self-medicating with food, alcohol, or other substances. You might neglect your own needs, skip meals, or stop exercising. Why does this matter? Because early recognition is your first line of defense. Studies show that those who identify burnout early are more likely to recover, less likely to make critical errors, and more likely to stay in the profession they love. Setting boundaries. Set boundaries to protect your energy and include evidence-based strategies. Let's be clear. Boundaries are not selfish. They are the foundation of sustainable, compassionate care. Research from the Mayo Clinic, American Nurses Association, and leading organizational psychologists confirms that setting and enforcing boundaries reduces burnout, improves patient outcomes, and preserves your own mental and physical health. What does boundary setting look like in real life? Physical boundaries. Protect your personal space and privacy. This means taking breaks, stepping outside, or simply having a quiet meal without interruption. Emotional boundaries, such as balance empathy with detachment. You can care deeply without absorbing every patient's suffering as your own. This is a skill, not a failing. Time boundaries. Limit your working hours. Say no to extra shifts when you're depleted. Schedule and honor time off. Flexible scheduling and adequate staffing are proven to reduce burnout rates. Professional boundaries, for example, uphold ethical standards, maintain confidentiality, and avoid overextending yourself beyond your role. This protects both you and your patients. Next, how to set boundaries. How do you set and keep these boundaries? Self-reflection. For example, regularly check in with yourself. What are your limits? What do you need to feel whole and present? Journaling or mindfulness practices can help clarify these answers. Assertive communication, for example, clearly express your boundaries to colleagues, supervisors, and family. Research shows that assertiveness training reduces stress and increases job satisfaction. Consistency by enforcing your boundaries reliably. If you say you need a break, take it. If you're off the clock, be off the clock. Consistency builds respect from others and yourself. Seek support. Lean on mentors, peer support groups, or employee assistance programs. Peer-reviewed studies confirm that social support is a powerful buffer against burnout. Prioritize self-care. This is not a luxury, it's a necessity. Sleep, nutrition, exercise, and relaxation techniques are all evidence-based interventions that replenish your energy and resilience. Focus on the basics and beyond, on high-impact strategies from leading research. Let's go deeper, because you deserve more than platitudes. Mindfulness and stress management randomized controlled trials show that mindfulness-based interventions significantly reduce emotional exhaustion and improve resilience among healthcare professionals. Flexible work arrangements, contract or per diem. Work can give you more control over your schedule and workload, reducing burnout risk. Organizational advocacy. Advocate for systemic changes, adequate staffing, realistic workloads, and leadership support. Burnout is not just an individual problem, it's a structural one. For regular burnout assessments, use validated tools like the Maslach Burnout Inventory to track your own well-being and advocate for institutional monitoring. Professional development. Engaging in ongoing learning and mentorship keeps you motivated and connected to your sense of purpose. The call to action, compassion for yourself, is compassion for others. Let me leave you with this. The world needs you, not just as a caregiver or clinician, but as a whole, thriving person. The research is unequivocal. When you protect your own well-being, you provide better care, make fewer errors, and inspire those around you. Burnout is not inevitable. It is preventable, it is treatable, and it is your right to demand a healthier, more sustainable path forward. So, recognize the signs, set your boundaries, reclaim your energy. You are not alone. You are not expendable. You are the heart of healthcare, and your well-being matters. Let's rise together, not just for our patients, but for ourselves, because when you heal yourself, you heal the world. Thank you for your courage, your compassion, and your commitment. Now take the next step. Choose yourself, so you can keep choosing to care. If this message resonated with you, share it with a colleague, a friend, or a fellow caregiver. Let's build a culture where caring for ourselves is the first step in caring for others.